Welcome to Anatomy and Physiology. Today we're going to talk about the organization of the body. These are the objectives from the syllabus, and this is what I crafted this lecture around. So we'll talk about the hierarchical structure of the body. We're going to talk about an important concept called anatomical position, and you'll learn the planes of the body. And then we will talk about anatomical terms that you're going to use through your whole career. Things like you've heard me mention already, proximal, distal, things like that. We'll also talk about the body cavities and regions so that when we are discussing or documenting on the body, that we're all using the same terminology. First, I want to talk about why anatomy is so important. Depending on what area of OT you go into, anatomy is essential. For example, in hand therapy, my specialty, almost everything we do is based on understanding the intricate anatomy of the hand and the upper extremity and the timelines for healing. In general, in the program, the curriculum design is based on something called Bloom's taxonomy, and you can see it in this slide. At the bottom of the pyramid is basic things like remembering facts and being able to recall simple concepts. Once you do that, we can work our way up and explain those concepts to other people. You can do things like identify things and locate them, recognize an idea or a concept and describe it. Working our way further up into more sophisticated areas is application. So how do you use those information that you've learned from the remembering and the memorization and understanding aspects, and how do you put that into new situations? Further up, you should be able to compare and contrast and draw connections between different ideas. And then even higher is being able to appraise a situation and evaluate it, make a valid decision and be able to justify that and have it hold up to critique. And higher than that, at the very top, is synthesis or creation of new material. The way this applies to anatomy is that you're going to be learning basic concepts. How does the body work? What is basic biochemistry? You'll also be recalling facts like what bone is which and what are the landmarks that are important on it. And you'll start working your way up, and understanding it, being able to apply it to different situations as we work through the different semesters. So what you learn this semester will build in next semester. And then in third semester, you're going to take first and second semester material and put it all together to do things like strengthen a muscle or stretch a muscle or be able to test a muscle. That will keep building through semesters 3 and 4 as you learn to make that part of a whole treatment. So what is anatomy and what is physiology? Anatomy is understanding the structures of the body, and physiology is understanding the function or how it works. In A&P 1 and 2, we'll study each of these systems. We're going to cover roughly half of them this semester, and next semester we'll cover the other half. Each system is a group of organs with a common function. And each system is built in a hierarchical fashion, and we need to kind of understand the different things we're going to cover today, like the body planes, directional terms, regions, in order to be able to talk about the different systems. You've heard of these systems before. The skeletal system, obviously, are your bones and create the internal scaffolding and protection. The muscular system, the nervous system, which is the brain, the spinal cord, and the nerves that come out of that and go throughout your whole body. The cardiovascular system, which is your heart, as well as all of the blood vessels running through your body. The endocrine system, which are hormones. And then next semester we'll cover the respiratory system, which has to deal with breathing, everything from how air enters your body from your nose all the way down through the lungs and the air sacs there. The digestive system, so the whole GI tract and the functions within it. We'll talk about the lymphatic system, which is a system that we've come to appreciate much more in the last 15 to 20 years, and has actually changed how we treat it because of that. So that is helping to restore normal fluid balance in the body so you don't get a bunch of swelling. And it also has an immune function as well. The urinary system is the structures and the process of creating urine and ridding our body of waste. The reproductive systems of the male and female bodies, and the integumentary system, which covers your skin. If we look at how this is laid out for organization, at this point we should pause and consider, what about the things around an organism? How much do those impact that organism or that person? The environment or context is something that's very important to OT practitioners. Think about the physical environment around us. Think about how chemicals in our water can impact a person or an organism or a population of people. There's areas of our country where they've done studies looking at the concentration of hormones in the drinking water and how that's affecting male versus female birth rates. Think about pictures you might have seen about Shanghai. People wearing masks and the amount of pollution in the air. How does that impact how much people go outside and the leisure activities they partake in? How does that compare to somewhere like Colorado, where a lot of people place a great deal of importance on being able to recreate outside and gain a lot of value from that? What about the diet of an area? If a certain community has a poor diet, can that affect the health of that group? What about ozone being depleted in the biosphere? How does that affect the organism and the health of the individuals? What about places where there are repressed populations that have lack of health care? They just don't have access to it. How does that affect that person or organism? The social environment's important as well. Interaction styles vary in different cultures. The amount of eye contact in America, we expect eye contact. In other countries, it can be seen as disrespectful depending on the context and the situation. The way that we talk to and interact with elders can be different. The way that we care for elderly parents, the level of care we provide them, where we do that in our home versus in other facilities, the level of independence that a culture expects, or maybe even how does a religion look at health and how does that impact things? For example, Christian scientists don't believe in having surgery. And how does that impact the health of a person? The psychological and culture environment also are important. Think about in the US, we have a very ambitious culture. What does that do to stress levels? Does stress affect health? Certainly. Now we want to look at anatomical landmarks and directional terms. So why is it so important that we have a standard language when we're talking about these type of things? Why do we want to make sure that an OT and a PT are using the same terms? Why do we want to make sure that when a surgeon writes something in a note that it's read a certain way and means the same thing by a physical therapist, or maybe even by a case manager, or maybe someone even further remote and removed in a different area? So there's lots of reasons. We need to make sure that we're all speaking the same language. You've probably heard examples of people having amputations that occurred on the wrong side of their body. My wife's a physical therapist. She's had several instances where people have come in and there have been errors based on this type of problem. I can think of one particular example where my wife had a client that came in for a total knee replacement, but she actually had both of them done, and that's kind of uncommon. So my wife asked how that happened, and why she had them both done at the same time when usually they do them at different times. And the patient replied that, well, they woke her up after surgery and they informed her that they had made a mistake and they had replaced the wrong knee. They had to have her sign a new release form and go back in and change the other knee. Other examples are, think about if something said in a patient's note they had an incision on top of the hand. Look at your hand. Where do you think that would be? Could someone else think it was a different spot? What if they said base of the hand? Look at your elbow. If something asked you to apply ultrasound, a modality that you'll commonly use, 1 inch from the elbow, where are you going to place that ultrasound machine? There's a lot of different interpretations there. Now we need to talk about something called anatomical position, and this is a key concept that's important that you grasp. Stand up for me. Put your feet together, toes facing forward. Look straight ahead, arms relaxed at your side, and turn your palms forward. This is anatomical position, and anytime we are referencing something on a person or their position, we want to kind of mentally put them back into this posture to make sure that we're using the correct terminology. You can see this picture shows what it should look like. And we're going to use multiple terms now to describe the body. Midline is an imaginary line drawn down the middle of the body. Medial and lateral are in reference to midline. So medial means moving towards midline. Lateral means further away. We've already used those terms with the epicondyles on the humerus. Remember, the medial epicondyle was close to the body and the lateral epicondyle was on the outside of the arm. That's a good application of these two terms. Left and right, we already know those. Proximal and distal are key terms that you will use daily in your documentation. When we're using the terms proximal and distal, we are generally referring to the extremities, so the upper extremity or the arm and the lower extremity or the leg. Proximal means closer to the trunk or midline, and distal means further away from the trunk or midline. So if you are thinking about the knee and the ankle, the knee is more proximal than the ankle, and vice versa. The ankle would be considered distal to the knee. This next slide, this slide is not in your book, but it's important because it adds two other terms that are really essential to our practice and our documentation. And these are ventral, also known as volar, and dorsal. Ventral is referring to the front side of the body, and remember that person has to be in anatomical position, meaning that palms are forward. I remember ventral because if you have a vent that helps you have air move in or out or breathe, that's on the front, that would be your nose and your mouth. So that reminds me that that's the ventral surface. Again, volar means the same thing. The back of your body, again, in anatomical position, is the dorsal side. So think about where a dorsal fin would be on a shark or a porpoise. So that's the dorsal side where the dorsal fin would be. All right, stand up. Let's try an activity to see how well this is sticking. We're going to play anatomical directions, Simon Says. Simon says, point to a body part that is distal to the elbow. If you point it anywhere between your elbow and your fingertips, great job. Simon says, point to a body part that is proximal to the knee. If you pointed to any area between the knee and the hip where your leg meets your trunk, great job. Simon says, point to a body part that is anterior to the spine. So there's a lot of places you could touch here. Anywhere in front of the spine, on the front of your body or the side of your trunk would work. Simon says, point to a body part that is medial to the thumb. If you touched anywhere on your index, middle ring, or small finger, or in the palm under those digits, good job. Simon says, point to a body part that is superior to the mouth. Anywhere above the mouth, your upper lip or nose, your cheek, around your eyes, your forehead, the top of your head, any of that would count. Point to a body part that is lateral to the middle finger. Well, if you touched your index finger or your thumb or the palm below those areas, you're close, but you got it wrong. Simon didn't say. Now we'll discuss the planes of the body. You can see in the various pictures that the planes of the body are similar to plates of glass running through, separating one side from another. Sagittal planes run from front to back, dividing the right and left sides of the body. You can see that this can occur in midline or anywhere laterally to either side. Think about when you see a CAT scan or an MRI image and they slice through different layers of the body in this exact same way. The next one is the coronal plane. The coronal plane runs from side to side and it separates the anterior from the posterior part of the body. It's also known as the frontal plane. A transverse plane is like a horizontal plane running through the body, separating the superior and inferior portions of the body. And when we hear about oblique planes, it means they are running at angles, like you see in the image here. The image to the right indicates that there's a video to play with this, so I will post that link in the course content as well. And that shows, I believe it's a CT image going through a body, through the different planes. So make sure you view that later as well. For this next slide, we're going to talk about the regions of the body. If you look in course content, I have put two documents there for you. One is the regional terms handout of all the ones that you need to know. And on there, in parentheses, are the layman's terms or more common terms for those areas. The other one I've posted is the same list without the information in parentheses so that you can really learn the information and use that to quiz yourself. So let's talk about the regional terms of the body. If we're looking at an anterior view, the acromial region is the shoulder, brachial is upper arm, dorsum is a little confusing. So the dorsum is technically, if we're talking about regions, it's the upper back. However, when you hear the term dorsal, that can mean anywhere on the posterior aspect of the body. So be careful not to confuse those terms. Olecramal refers to where the olecranon is, the back of the elbow. Lumbar is the lower back. Antebrachial is the forearm. Carpal is the wrist. Manual is the hand. Gluteal are the buttocks. Perineal, that's the region of your private area, so genitals and between the anus and your genitals. And we hear that term a lot for perineal care. We help clients with that as a part of toilet hygiene. The femoral region is the thigh. Popliteal is the back of the knee. Sural is the back of the leg. And calcaneal is the heel. When you hear upper extremity, that means upper limb, and lower extremity means lower limb or the leg. The vertebral region is the spinal column. The sacral region is between the hips, where your sacrum is. The occipital region is the back of the head. And the plantar region is the sole of the foot. Now we're moving on to the cavities of the body. You can see that there are dorsal body cavities in the back and ventral body cavities in the front. The cranial cavity is where your brain resides, and your spinal cavity is the other dorsal body cavity where your spinal cord resides. The ventral body cavities include the thoracic cavity, where your lungs and heart are. And we can break that into smaller cavities as well. The pleural cavities on the left and right are where your left and right lung exist. And the mediastinum is the cavity in the middle of that where your heart resides. So you can see that, if we're talking about one area in the chest, you could use the term thoracic cavity, and that could be correct. But you could also use the term maybe pleural cavity, and that could also be correct, depending on how specific we're being. The diaphragm, you can see in this picture, is a muscle that helps with breathing, and that's just separating the thoracic cavity from the abdominopelvic cavity. So the abdominopelvic cavity is everything below there, where your abdomen and your pelvis reside. We can break that into smaller cavities. So the abdominal cavity is where the stomach and most of your intestines are, and below that is the pelvic cavity, where your pelvis is. We also need to understand the divisions of the abdominal cavity. You can see right and left here, and you can see other terms that are used repeatedly. You can see hypochondriac is used on left and right side, lumbar as well, and same thing with iliac. So this isn't quite as difficult as it looks like at first glance. In the top, moving from the right side of the client to the left, you see the right hypochondriac region. Hypo means below, and chondral is referring to rib cartilage. And when you put those together, that makes sense with what you're seeing in the picture there. On the top middle portion, you have the epigastric region. So gastric means stomach and epi means above. Again, that kind of makes sense. And then we have the left hypochondriac region. So again, on the left side, hypo is below, chondriac is referring to rib cartilage. Moving to the middle row, we have the right lumbar region. Okay, so lumbar is referring to the lower spine. Then we have the umbilical region, meaning the umbilicus or your navel. And then the left lumbar region. The bottom row, you have the right iliac or inguinal region. Okay. Iliac is referring to the ilium, which is the top of the hip. And then we have the hypogastric. Hypo means below, so it's below the stomach. And then we have the left iliac or inguinal region as well.